thanks so much for joining us for our video series on the Delaware Child Psychiatry Access Program. It's been really fun to talk about this innovative program during May, which is Mental Health Month. And we have Dr. Mark Borer, who is the consultant with the Delaware Child Psychiatry Access Program. And he is going to talk to us a little bit about how do we engage our partners in the healthcare community and how they can work with DCPAP. So Dr. Borer, can you kind of talk about just what are some of the benefits about enrolling with this program?
Thanks, Jen. The main benefit is that kids, adolescents, and their families on their behalf can get support earlier right in the office of their primary care practitioner. And that's support for their mental health, support for emotional issues they may be going through, even some issues that they're going through at school with relationships. And by having that access sooner, it helps kids to feel better quicker. And that means better times for parents, less worry, and less lost work time.
Definitely, no, that's great. And can you talk a little bit about just some of the added benefits for engaging with DCPAP? You know, what are some of the professional development opportunities that people can take advantage of?
Yeah, that's great. We have CME programs, which means continuing medical education programs, and we have them almost monthly. And on topics, ADHD, depression, suicide, autism, post-traumatic stress. So when we do those developments, they are open to any professionals in the community, any mental health professionals, medical professionals, school professionals. And that helps us to be able to develop the workforce so that people are out there and they know better how to serve kids. And that creates more access to care so that people don't have to be on long waiting lists and they don't have to worry about, not having someone informed.
That's great. And I know we've touched on this a lot with the availability and the access of these resources. Can you kind of talk a little bit about really, the state of child psychiatry and, where things are today in terms of, perhaps, lack of availability and how DCPAP can kind of help providers in the future, empower themselves and in turn empower their patients and families that they work with?
Thanks, Jen. Child psychiatry, as most people know, is a shortage specialty today. And so there aren't enough child psychiatrists to see every child that would need our support or our help. However, by having the DCPAP program, we can spread ourselves out more so that with the primary care physicians who know the kids, who work with the kids, often pediatricians that have had these kids in their practice for a long time, they can access us and we can give them ideas and help in supporting those kids right in their own office. As far as the future, I think by having this increased contact between mental health teams and their teams, we can move more toward collaborative ventures together where we all get together to do multidisciplinary treatment planning, where we look at how we branch out into the community and get support and give support to kids out there. And it just opens things for better precision medicine as we follow new measures and parameters till kids get better. So we're really happy to have DCPAP, really paving the way for more of that action to happen as we move into population health and helping people have a sense of you're going to get help in your neighborhood, And so I think that makes a big difference.
Definitely, that's wonderful. So I guess just in closing, can you kind of just remind folks, the phone number that they can reach out to if they want to get connected to DCPAP and just the website that they can go to?
Surely. The phone number is 302-513-0929, and that's an access number not only that the primary care folks can call for consultation with the child psychiatrist, but also a number they can call when they need resources through our coordinator, Mindy Webb. And if they tune into kids.delaware.gov, there is mention of the Child Psychiatry Access Program, and it'll take them right to the website. And we have an app, we have other ways. So once they get through the phone or the other line, they'll be able to find access to these other ways. The whole idea is access to care, getting kids to help sooner and helping their families.